Good morning, everyone. Welcome to the Pitt County COVID-19 Media Session number 12 for April 23rd, 2020. We have some opening remarks from Dr. John Silvernail with the Public Health, and then Brian Floyd with Vidant, and then we'll open the floor to any other prepared statements from our other municipal or community partners, and then we will have a question and answer session. So we'll get started with opening comments from Dr. Silvernail.
Good morning, folks. Today makes 2.5 incubation cycles since the first case of COVID-19 was identified in Pitt County. We continue to see growth in our case counts, but the rate of growth remains stable. We know that confirmed cases underestimate the true number of cases in Pitt County, but at this time, it is the only data point we have. We will have a better estimate, and I stress estimate, of the true burden of disease once good antibody testing is widely available and that data is collected and analyzed. I will prepare a brief summary of basic epidemiology for the public and the media for our next session. As I said Tuesday, I am cautiously optimistic about where we are in this epidemic. Thank you all for your patience through these trying times. Thank you for following our recommendations. Please hang in there. We will get to the other side of this eventually. Let's take a look at our case counts this morning. Across the state, there are 7,608 laboratory confirmed cases. In Pitt County, we have 101 laboratory confirmed cases. We estimated yesterday a recovery of 61 of those cases. I've not had a chance to do that analysis yet this morning. We'll report a new number later today. North Carolina deaths total 253 as of this morning. In Pitt County, we have 2 laboratory confirmed deaths at this time. We currently know that at least 842 persons have been tested in Pitt County. Again, we have 101 positive results. That represents 13% of the returned results this time, and our percentage of positive tests continues to decrease. Negative results are 673, representing 87% of our testing at this time, and we are aware of 68 tests that are pending. I'd like to move on and touch on some other public health issues this morning. Severe weather. There's the potential for some severe weather later today and through the night. Please take appropriate action to protect yourself, your loved ones, and your property. Telehealth. Yesterday, Pitt County Health Department released a statement about telehealth. Many of our services are now available by telehealth or a blended telehealth / in-person visit. Please take a look at that release for details. Public health nurses. Public health nurses perform a number of tasks in our agency. They track and record communicable disease. They investigate communicable disease. They administer vaccines. They perform well child examinations. They screen and treat sexually transmitted infections. They follow some of our pregnant women in this town and county, and they follow some of our newborn infants, just to name a few things. Thank you to our Pitt County public health nurses and public health nurses everywhere. Finally, please go home and stay home. Thank you.
Good morning, I'm Brian Floyd with Vidant Health. This has been a difficult time for so many in Eastern North Carolina, and that includes Vidant Health. We've been at the forefront of conversations about the challenges that face systems in rural America, and especially here at home in Eastern North Carolina, where we have an underserved population with a high amount of disease burden and less insurance and more reliance on Medicare and Medicaid services. These challenges have only intensified with the COVID-19 pandemic. As with many systems around the country, we've had to change the way we operate to accommodate our needs associated with this pandemic. Due to a temporary closure of some of our services and some cancellation of procedures, Vidant's been experiencing a decrease in the revenue while at the same time having to increase the cost of care. What I mean by that is normally when you reduce the revenue, you also reduce your cost. But in our case, we are increasing our cost to be prepared for caring for a surge of patients with COVID-19. That's true for health systems across the country, also true here at Vidant Health, and we are having to make some changes associated with that. As a result, we had to take immediate action and adjust our workforce structure in order to support these changes. To be clear, we do not know what the final impact to our system will be financially, but like other healthcare systems around the country, we know that it will be very significant. This is an evolving situation, and we'll continue to assess how best to deliver care and move forward. But at this time, we're focused on the continued communication with our employees, so I will not be taking additional questions today regarding yesterday's announcement to workforce changes. I will, however, be happy to answer questions about COVID-19 and the response the system is having as we deal with that. We remain eternally grateful to the community's response in helping us, and also your response, staying at home, social distancing, and things that have truly made a difference and impacted the curve. Today, we have roughly 40 patients in the hospitals across Vidant Health. That means for us that we're doing a good job of managing the spread of this virus and preventing the surge. We need to keep doing that work. Also want to remind the public that Vidant Health remains open and here for you should you need care. There are nearly 500 patients in Vidant Medical Center who are non-COVID patients, and we continue to make sure we're ready to take care and safely take care of the patients who need care otherwise. So if you do, feel free to seek care with your physicians or certainly here at our hospitals. Thank you again for all you're doing to help us and help our system respond to COVID-19.
Okay, before we get into a question and answer session, we'll open the floor to any of our municipal and community partners that are on the call, if they have any prepared statements as well. I know we have Greenville Utilities, City of Greenville, Pitt Community College, Pitt County Schools, and the airport as well. So if any of those partners have a prepared statement, just opening the floor. Okay. Seeing that, we'll go into our question and answer session now. We'll start with questions for Dr. Silvernail in public health, and we'll go from there. Excuse me, had to grab my list. We'll start with, in order of called in, WNCT, Ariana Kraft. If you have any questions for Dr. Silvernail.
Yes.
Okay, go ahead and say your question as he's coming up, please.
Good morning. When it comes to, we're seeing a lot more outbreaks in meat packaging or food processing facilities. So when it comes to these facilities, what are the best safety procedures and practices that should be going on?
Thanks, Ariana. First, can I mention my laboratorians? This is National Laboratorian Week, and we do have a in-house laboratory at the health department, which has generally three laboratorians who work there processing samples. And I'd like to say thank you to them for all their hard work, and happy Laboratorians Week. As to any industry where workers are close together, requires some special attention. The meat packing plants and poultry processing plants tend to be kind of wet environments, which do help the virus to survive. And that may be part of why there have been some outbreaks in those facilities. We understand that the manufacturing process may be hardwired, and it's difficult to sometimes separate them by 6 feet to prevent spread from person to person. So in those cases, the employer would have the option of masking employees and providing some sort of personal protective equipment to the employees to prevent the transmission of the virus in those settings. Some of our factories have already taken those steps. I have visited a couple of our employers here in Pitt County and looked at their modifications, reviewed their modifications with them, and hats off to them because they have really done a good job. Fortunately or unfortunately, we do not have a meat or poultry processing plant here in Pitt County. Some of that, again, the assembly line or processing line is kind of hardwired, and it's more difficult to spread those workers out. So, PPE in those settings would be the best option.
Right. And oh, sorry, go ahead.
I was going to say, did that get your question answered?
Yes. And then when it comes to, in the unfortunate case that an outbreak does happen in these facilities, what is the best step moving forward before it's opened up again? Does it need to be, a huge cleaning system going on before it can have its employees back?
Yeah, part of bringing that outbreak under control would be the rapid identification of cases, the isolation of the case and the quarantine of those contacts who are felt to be close contacts and at significant risk for developing the infection. The normal cleaning process of the plant should be enough to remove any residual COVID in the plant. As we've said before, most common cleaning products will destroy this virus or inactivate this virus. So they probably don't need to do any kind of big fogging operations. Their normal washing and cleaning operations should remove any residual COVID virus in the plant.
Awesome. And we're seeing in other surrounding counties as well, more asymptomatic COVID cases popping up, whether it be someone's tested before a procedure and they were positive, even though they didn't have symptoms. So can you just reiterate a little bit about these asymptomatic cases and, the best way to be mindful of these as we're, continuing this fight against it?
Yeah, I guess, Ariana, if you don't have symptoms, it's almost unknowable. So we think some of these folks may have some mild symptoms. Again, we've had 4 months experience with this infection, where many other infections we've had decades, if not centuries, of experience with them. So in the aftermath of this, there are tens of thousands of articles yet to be written about this infection. In terms of protecting ourselves from those that may have the infection but not have classic or overt symptoms, obvious symptoms of the infection, the social distancing, maintaining yourself 6 feet away from someone, wearing masks can help you if you have the infection to not transmit the infection. Masks on yourself may also decrease your risk of contracting the infection, but it's not a guarantee either. And again, to make sure that you are washing your hands or sanitizing your hands frequently, especially before you touch your eyes, your mouth, nose, before you apply cosmetics, before you eat, things like that, so that you don't inadvertently put that virus into your mouth or nose or eyes where it can grow and cause an infection.
Great. And we are now seeing that a couple cats in New York have tested positive for COVID. So when it comes to our pets now, is there any comment you have when it comes to this particular situation where we're seeing a possibility of pets contracting this?
Mhm. Well, I'm not a veterinarian, first of all, but we do love our pets. There have been some examples of cats, both domestic house cats as well as large cats like lions and tigers, who have shown that this virus can at least be harbored in their body. Whether it can actually produce the same infection syndrome as it does in humans, I think is another story. To my knowledge, none of these animals were actually sick with the virus, even though it was demonstrated in them. So it's sometimes the virus is able to invade a host, but not completely reproduce itself or function in that host to produce illness in that host.
Gotcha.
Um,
Thank you so much. That's
you're
perfect.
welcome.
I appreciate it.
Can I add one comment to that there, Ariana?
Oh, yes, of course.
If you go back to the 2009 H1N1 pandemic, as people did research, that virus was also found in large numbers of animals, or at least demonstrated in large numbers of animals. Sometimes I think there was even a camel that tested positive for H1N1 at some point. So many times with these viruses, we can find evidence of them in the host without actually finding infection of them in the host.
Thank you for your time, Dr. Silvernail.
You're welcome.
Okay, moving on. Next up is WITN, Hannah Jeffries. If you have any questions for Dr. Silvernail.
I do not at this time.
Okay. Next up with the Daily Reflector, Elizabeth Johnson. Do you have any questions?
Yes. So the amount of positive coronavirus cases is decreasing, you said, correct?
The percentage.
Yeah.
Oh, I'm sorry, go ahead.
Sorry, so the percentage of positive cases is decreasing, correct?
Yes, so when I look at the data, the number of cases that are positive in our data set as a percentage of the data set are decreasing. And that decrease has been consistent for the past week. We had peaked at about 20. One day we actually touched 21%. But beginning last Thursday, there's been a steady decline in the percentage of our testing that returns as positive. So I think that's encouraging. When I look at other markers like the state curve of cumulative cases, that appears to be plateauing. So again, I think we have been successful in cutting down the height of the wave or flattening the curve and spreading that burden of disease out over time so that we can match healthcare resources with healthcare demand.
Okay, and as this percentage decreases, is that due to an increase in testing? What can this be attributed to?
Well, I'd like to think it's a decrease in burden of disease, but I can't prove that yet.
Okay. I think that was my last question. Thank you.
You're welcome.
Okay. Next up with WCTI, Tyler Hardin. Do you have any questions for Dr. Silvernail?
Yes, good morning, Dr. Silvernail. I just wanted to ask you again about the age range. I know I've been asking this throughout these media sessions, but has that age range of the active cases, has that changed from 17 to mid-70s?
I think that's still a pretty good estimate, Tyler. I'd have to go back through and look and see if there's anybody older than the mid-70s. But I think that's still a pretty good estimate of our age range here in Pitt County.
And do you have an estimate too, or projection as far as when we could peak with the cases here in Pitt County, and how many of those cases could we see at the peak here in the county?
Well, confirmed cases, I guess, I would think we're still probably just shy of that peak. Again, looking more towards the end of the month here, beginning of next month, I would guess estimate that we would peak somewheres in the 125 to 135 confirmed cases across the county at this time, looking at the rate that they're coming in.
Gotcha. And then just to kind of, I guess, wrap things up, I know that we're less than a week away from obviously the governor's executive order expiring, and there's been a lot of talk with the county commissioners and a lot of folks about kind of reopening the economy. I didn't know if you had any kind of more thoughts necessarily on if the governor should extend that, or if local leaders should consider, even starting up their own executive order continuing that.
Well, I think, Tyler, legally we're obliged to follow the governor's order. I know locally there's been a lot of discussion about what we can do. I think some progressive reopening of things is probably appropriate. We do need to get back to work. We do need to get the economy moving. There are some concerns that people are deferring medical care at this time, not availing things. I'm sure Mr. Floyd would love to have some elective procedures back in the institution here in town. And if you put off an elective procedure long enough, it doesn't stay elective sometimes. So that's the other side of this, is that, it's okay to defer care sometimes, but eventually if you defer it long enough, it does become urgent or emergent, and you can start to affect outcomes. So if the hospital system has capacity, it'd be reasonable to allow them to start doing that again. Again, I ran my own practice in New York. I, practiced and lived through the pain of the recession in the early 2000s. I feel for our business community. I want to see them open, but I also, this is the only countermeasure we have against the infection right now. So we do have to be cautious in how we reopen business and the economy to make sure that we stay ahead of the curve and don't allow that spike to come and overwhelm our healthcare system.
Okay, Dr. Silvernail, thank you for your time.
You're very welcome. Have a good day.
Dr. Silvernail. Next up, we're going to bring back Brian Floyd for questions specifically in regards to Vidant and their efforts on the COVID-19, and then we will open up for questions to all of our other participating partners. Starting with WNCT, Ariana Kraft, do you have any questions for Vidant?
Yes, kind of reiterating what Dr. Silvernail just said, with people, fewer people coming in for outpatient and emergency visits, what would you like to say to that, when it comes to the community members who might be wary to come in because of COVID?
Well, thank you for the question. I want to first say, reiterate what Dr. Silvernail just said. It is really important for people who need medical care to have confidence that they can seek that medical care, and let the healthcare professionals guide you through when it's right to have, procedures done and the like. Vidant has safely planned for and made available the ability for us to do the work we need to do to keep our patients safe. And that means separating the concern of COVID from the work that we do every day to care for patients. And that is going very well, and we are getting very good outcomes. And so we are now been focusing our attention on, we electively chose to reduce the volume in our hospitals at the time that we were trying to anticipate a surge of patients coming in with COVID. The great work our communities are doing to social distance and wear masks and protect from the spread of the virus has allowed us to see a lower number of patients by far than what we initially were anticipating. And what that means is between that and the processes that we have built over the last several weeks to ensure we have the PPE that we need, to make sure we have the capability to separate out the risk of patients with COVID, the testing capabilities that we are growing in our capability to have, which means we can test patients to know who does and who doesn't carry the COVID virus. What that means is we're getting closer to the time in which we can do more and more of the elective outpatient procedures that we had previously stopped. So that's a thing that will continue to grow over the next coming days. But we certainly want the public to know that the hospital is open. We have plenty of people capable of caring for them, and we are confident in our ability to have safely segmented that population and the risk of COVID spread among people within the hospital environment.
Moving forward, do you anticipate Vidant will be looking to state or federal help right now?
Yes, we are working with state and federal agencies. All health systems around the country are feeling the same pain of the change necessary to ready for COVID-19. We are not unique in that. What we are unique in is the fact that we live in a part of the country where there is less insurance and a higher disease burden in the population of Eastern North Carolina. So we feel these changes a little differently than most systems do. I think we did all the right things necessary to be sure we were ready to care for patients with COVID and do that safely, protect our team members and our physicians, and make sure it was a safe environment. We've done all those things, but obviously that costs a lot of money. And at the same time you're doing that, you are reducing the money coming into the hospitals by reducing elective procedures and the like. So what that means is the curves are in the directions you would never want from a business perspective. And we know that there will be state and federal support to help us as we rebalance from this COVID thing. Now, we also have to keep in mind, we've done a great job keeping the curve down, but we need to continue to do that so that we don't overwhelm the healthcare system and go back into one of the worst case scenario environments we initially were trying to manage against. But yes, we will be working with state and federal agencies to help bring relief into the hospital as is being done around the country.
And is there any possibility of UNC coming in and helping and taking over possibly, or anything like that?
Yeah, I don't have a comment about that kind of competitive landscape. I think that it's safe to say, and we are in contact with UNC and the other hospitals around the state in a collaborative way, working to ensure we're able to manage this pandemic crisis in our country. And so I think all of our effort right now is focused on how do we do the right thing for Eastern North Carolina. And we will continue to do that and be well positioned on the other side of this COVID pandemic to continue to care for Eastern North Carolina collaboratively with other partners around the state.
Thank you for your time.
Okay, next up with WITN, Hannah Jeffries. Do you have any questions for Vidant?
I do. Good morning. Just through your expertise, and obviously we have to listen to what the governor is saying, but through your expertise, how do you feel about when would be a good time for our economy to open back up and people go back to work? Is that something that you foresee that's in the near future, or do you foresee that that's long off as we entertain these possibilities of reopening certain things?
Well, thank you for the question. I would leave the decision-making about the governors and elected officials' obligations about turning on the economy, if you will, to them, and just say that we are working collaboratively with both city, county, and state officials to understand how COVID is behaving in our market. The most important thing to remember, all the decisions we've made have been about containing the spread of the virus and then making sure that the health systems are able to handle the worst case scenario if spread overwhelms those systems. We have worked in an incredible collaborative way with government to make sure we're doing that we are in fact ready. And couldn't be more appreciative. That has allowed us to not be in trouble here at Vidant Health with an overwhelming number of patients beyond which we had the capability to care for. A lot of that has been about the protection of our team members and the patients as they are coming into the organization. So there are certain behaviors and things like social distancing and wearing masks and washing your hands and all of these behaviors that do help contain the virus, that regardless of what businesses are open or closed, those are absolutely essential things that have to continue. And if we're going to keep from having a surge of COVID, we're not out of the potential for there to be a second wave or a large surge of COVID patients coming through if we stop those behaviors. Well, the officials know that. They know that we seem to have a steady number of patients now, and there seems to be a flattening of that curve. And so I think it's reasonable to conclude that there will be decisions made to help reopen the economy and help get businesses going and get people back to work. But they will need to do that safely, and we will monitor together what the impact of that is to make decisions about how long that could continue or should there be a change to that in the future.
Great, thank you.
Okay, next up with the Daily Reflector, Elizabeth Johnson. Do you have any questions?
Yes. Hi. So how do we keep the curve down when we reopen? Is there any fear that we could see a spike in cases?
Well, that's obviously always a concern, and it will be incredibly important to follow the lead of other nations and other environments where they have gone before us in this. It is all about the behaviors and the decisions that people make in the public, regardless of what setting they're in a company, in a business, in a store. It's so critical that we all do our part to continue to prevent the spread. We know what those things are. We know how to socially distance from each other. We know how to avoid the tendency that if we're going back to work or our business is open, that means the behaviors just go back to where they were before. We cannot do that. So I think we'll have to hold each other accountable in the public, regardless of what businesses are open or not, to make sure we at least practice those good behaviors of socially distanced hygiene, wearing masks and things to help prevent that second wave. Otherwise, the virus is still there. And yes, it will spread again if we're not careful to manage against that.
Okay, so these practices we have is, 6 feet of spacing, wearing masks, all that stuff. Is that something you could see us continuing to do for the next 2 years or even longer than that?
I don't know the answer to that question. I think we will all be watching how this virus behaves now into the fall, into the coming year even. We are learning lessons about this as we go. We are learning what works. We are learning how our natural tendencies make us more vulnerable to spread. And so I think we'll be learning over time how to manage the way we behave and how we interact with each other going forward. I don't know how long that will continue. We'll just have to watch and see how the virus manifests.
Okay, thank you.
Last up with WCTI, Tyler Hardin. Do you have any questions?
Yes, good morning, Dr. Floyd. Last month, we heard the kind of financial status of the healthcare system. The budget shortfall was around 15 million or so. What is the financial status now here a month later with Vidant Health?
Well, we are still monitoring that closely. As I mentioned earlier, we don't fully know what the impact was going to be long term. As we finished our books, you just referenced the numbers of ending our month in the operating red, which happened because of the factors I spoke of earlier. So we'll be watching that in the coming month as we close the books in April. We anticipate it will be even a more financial strain than it was in the month of March. We know that will be the case because of the work we've had to do that we talked about. The question will just be how fast can the system respond to that? As I mentioned earlier, we've had to make some difficult decisions that are very hard to do necessary to bring our costs down so that we can begin to stabilize the finances of the organization. And so we'll have to take that 1 month at a time, 1 week at a time. And those things will also change as the volume within the organizations begin to change as well. And so we're confident forward, but we're going to be working with other agencies and internally to change our cost position to match the dollars that we have with which to care for Eastern North Carolina.
I know you mentioned that it's hard to kind of know the impact yet. Do you have any kind of projections on the dollar amount by chance?
I'd be reticent to say that publicly at this point, as we're still gauging what that's going to look back like into the future. So I'd rather reserve comment there for now, just that we will be transparent about what we're dealing with as we go forward. Right now, our focus is to help our team members understand what's going on first, make sure that they know what we're doing, why we're doing, and how we work together to bring about the best financial outcome of the organization that we can. We're focused on that, and we're focused on how do we help our patients understand how they need to receive their care. As Dr. Silvernail said, one of our concerns is just that people are forgoing necessary health care that they may not feel is as necessary as it is becoming. And so right now, all of our focus is on how do we do right by our patients? How do we do right by our team members? How do we collectively learn the impact of what we have had to do over this rapid amount of work over the last several weeks? What's the impact of it? We will project that forward. We are doing that, and that's what's causing us to make some of the adjustments that we have, but I wouldn't want to give specifics here today.
Okay. I know several people who were on the schedule to have an elective surgery, and now obviously that's been put off. Do you have kind of a timeline or a sense of a timeline of when you will start those elective surgeries here in the future?
Yeah, we don't like to necessarily use the word elective. Surgeries are necessary when people are having them. There are degrees to which it is necessary now and how urgent that surgery might be. We have always been doing surgeries. We never stopped doing surgery, and we never stopped doing surgeries that people are choosing to have. It's a matter of how many did we schedule at a time, and what severity of illness did we use to determine that people should go ahead and have surgery. So we lessened it, and I'll tell you that we are increasing that number. We're working with our physicians to make sure we can safely do that. And what that looks like is patients having a COVID test first. And so we now have the testing ability to do that. And as that's happening, we're beginning to increase both today and tomorrow additional surgeries into next week. I think we'll be doing a lot more of those elective procedures.
Earlier in your remarks,
notified directly regarding that with their physicians. If they have questions, we're encouraging people to ask, but over the next coming days, we'll be notifying patients of when we can resume that and scheduling those.
Gotcha. Earlier in your remarks, you were talking about the cost of care and how you've had to increase that cost of care for putting it onto the patients. Can you talk a little bit about how large of an increase you've had to make to help prepare for the impacts of COVID-19?
Well, I'll say that it is significant. I don't want to get into the specifics of dollars here and would rather wait until we're ready to talk about the comprehensive picture. But it is a significant amount of cost for a variety of reasons. One is in which when we didn't have the volume in the hospitals, but we continued to have workers and we had people in process ready for the potential for a large volume at any time. Obviously, that costs a lot of money, and that is cost associated with the readiness efforts. We obviously had to change our supply lines and make sure we had excess supplies at a time that there was a high demand for those very supplies like masks and the like. So we did a lot of readiness associated with buying products, bringing in people, and building process and things necessary to weather the pandemic. And then, of course, having a high cost of labor associated with the time in which we didn't have a lot of volume in our hospitals. That's all what's happening with health systems all around the country. It's not a unique thing here, but something that we're rebounding from and having to adjust to. But I don't want to give a specific number on the cost today.
Okay. I know you mentioned a lot of challenges with insurance. What is Vidant kind of facing with insurance and Medicare? Are you getting those reimbursements in a timely manner? What does that look like?
Well, that depends. Insurance and the financing of healthcare is an incredibly complicated thing to talk about. The We are working with all of our payers to ensure patients are cared for. We render that care regardless of the ability to pay. And then we work on the back end to make sure we have reimbursement. What we know is true is that there's a higher amount of government insured Medicaid, Medicare population. And in rural environments like ours, it's a much more difficult thing to manage the cost of health care when you're in environments where there is an excessive amount of health care that needs to be rendered to a sick population. So it's something we talk about all the time and have been long before COVID became an issue for us. That continues to be our story. But all of our, we continue to work with payers and are collecting the reimbursement associated with rendering care to the patients as we were before all of this.
And I know you mentioned earlier that there's around 40 COVID-19 patients within Vidant Health. What is your capacity now for accepting and admitting more COVID-19 patients across the system?
Well, we created an excess amount of capacity early on, not knowing would that number be 100, would that number be 1,000, as we've been using the models to determine what that number needs to look like. We created the capacity to care for well over thousands of patients with this, if that's what we needed to do. We are a very large organization and we have a large capacity to render care to patients. And if they are COVID, then that's what we're rendering care for. So we have a tremendous capacity to care. What the thing that's important to know though is there are also all the other patients that were already in the organizations before there was COVID. And so this is one of the nation's largest hospitals. And so what that is a result of the fact that there is a lot of disproportionate disease burden in Eastern North Carolina. We still have to take care of all of those patients. I mentioned earlier, today alone, there's more than 500 patients in the hospital that do not have COVID. So when we talk about our capacity to care for the COVID population, it's why we have to dial back the amount of care we're rendering to more elective or less urgent needs, so that we have the excess capacity should there be the need for the COVID population. It will move up and down depending on the needs of our community. And it's certainly well in excess of 1,000 patients. But again, our goal is to try to minimize the need to render that much care to patients that consume a tremendous amount of PPE, as you're hearing about in other parts of the country. We're fortunate that the community has worked hard and worked with us and been patient and done the right things to help blunt that curve and keep it well below those excessive capacity constraints in our organization. And 40 patients is about where we have been now for some time. So it's a stable environment, and our teams are just doing an amazing job taking care of these patients, and they're doing well. And I couldn't be more grateful to the community as well as our team members for what they're doing.
And speaking of that PPE and the labor and the team members who are obviously dedicating a lot of hours to this, how much money did you all put into the preparation and buying all the supplies to potentially have to care for 1,000 COVID-19 patients across Eastern North Carolina?
Well, some of this, again, it's a more complex thing to get into here today. I'll just say that we put the necessary amount of dollars into making sure we have the equipment to protect our team members. There are other costs that go into readiness associated with how you prepare the organization, isolating certain areas. The biggest cost, of course, is not doing the normal work that you do. And so you have a steady amount of costs for labor and other things that are fixed costs of the organization. And then, of course, you're not doing a lot of elective procedures that generally produce more of the revenue for the organization. That is the cost that's hard to calculate. But it costs millions of dollars for an organization like us to be ready to deal with a pandemic like this. Some of those costs have been now, some of those costs have been in times past when we bought pandemic supply lines and things of that nature.
Certainly. And with 500 non-COVID patients in Vidant Medical Center and then 40 patients across Vidant Health, I guess compared to years previous, how many patients would Vidant Health normally see now compared to in years past?
Well, I'll speak specifically since we mentioned Vidant Medical Center as a whole. We typically, on a daily basis, have more than 750 to 850 patients in Vidant Medical Center on a given day. So we have been running roughly just a little more than half the volume in our hospital than we normally would. Our
Okay,
emergency
and
department volumes are about half what they have been as well.
gotcha. Thank you for that. And then as far as your staff members who are helping care for those COVID patients, how many staff members come in contact with them? Is there kind of a number of those folks who are dedicated to those 40 patients across the system?
Well, it's a large number of people, obviously, because all kinds of specialties need to take care of the patients. We cohort the patients in a certain area, and we have team members that are more likely to be in that space caring for those patients, depending on the unit, if you will, that they work in. But obviously, team members in the emergency department, for instance, come in and they may be in that area where we're taking care of those patients. So it's hard to quantify a number. All of our team members are trained in how to be ready to take care of COVID patients. And have just been doing an amazing job making sure they protect themselves, they protect those patients, they render excellent care to those patients, and at the same time, they are protecting Eastern North Carolina and the organization by practicing rigid discipline about making sure we don't spread the virus, and that has been going incredibly well. And then I'll only add to that the hardship of all of this is also the fact that we don't have a lot of visitors helping us and being there to help comfort caregivers. That has been both hard for the caregiver as well as hard for the patient, and something that we know is a stressful time. We're hopeful that the work that we're doing to continue to alleviate that and increase our communications helps with that. But I'm so appreciative to healthcare workers that are going above and beyond to try to help us manage through this difficult time.
And as you've mentioned previously in other media sessions, you are all, I assume, still modeling every day about the peak here in Eastern North Carolina. Do you have any updated information about when we could see that?
It's hard to know. I mean, again, as you just said, we think we have been seeing a level amount of patients coming in. You could argue that is the peak, and that the peak is here now. So much does depend on what's going to happen over the next coming days and weeks that I can't foresee. It will depend on how we all continue to manage down spread. So we kind of have to take it. We projected the future, trying to make sure we understood what the worst case scenario would be and what is the demand on the health systems if it were at those levels. And so we predicted and worked from a period of what is the most significant demand for us and work our way backward from there. The good news is we're seeing a much lower number that seems to have plateaued.
And I know the next step in this fight against the coronavirus is antibody testing and formulating a vaccine. I know previously you all stated that you are starting that up. How far are you? Have you started that antibody testing in Biden Health?
We are working through that now. We're just at the beginning phases of that kind of work. And so it's very early to say in that, but yes, we are developing plans so that we can start doing surveillance programs and the serology testing for patients to determine what our overall risk is and what our community's immunity looks like and that kind of thing.
So you haven't tested for antibodies yet, but you're still working on it, correct?
We're working on that now. We're just getting the testing capabilities for all of that.
Okay. All right. Dr. Floyd, thank you for your time today.
Thank you.
Okay, we've had a couple of our partners have to drop off for some other calls, but I do believe we still have Pitt Community College and Pitt County Schools still on the line. So we'll go through our media partners and see if you have any questions for those. And if not, we'll close out. So starting with WNCT, Ariana Kraft, if you're still there, any questions for the partner still on the line?
No, thank you.
Okay, Hannah Jeffries, WITN, any further questions?
No, thank you, sir.
Okay, Elizabeth Johnson, Daily Reflector, any further questions?
No, thank you.
Okay, and Tyler with WCTI, any further questions from you?
No, thank you.
Okay, well, thank you very much for attending and participating. Our next session will be session number 13. That will be coming up this coming Tuesday, again at 11:30. Thank you for all attending, and I would again encourage anyone watching, if you have further information requests, you can go to our website at www.pittcountync.gov/coronavirus, where there you can also find information on how to fill out a form for further information requests as well. Thank you for all attending.